Greetings. Now, as a woman, after your IVF, right? When is the best time for you to test for pregnancy? When are you going to test whether you have tested positive after IVF? You see, in IVF, after the fertilization has happened in the test tube, right? And the embryo has been transferred into your womb, you will have to wait for 2 weeks. 2 weeks for you to go and do a pregnancy test to see whether you are positive. You understand? You can even wait for 3 weeks, but the recommended is 2 weeks after the embryo transfer. That's when you will go and test whether you are positive or not. When you test and you are positive, no problem. That's good. When you test and you are negative, it does not mean that you are negative. The embryo, the IVF has failed. Go and test again in a week's time. If you are still negative, then you can, that's a cause for concern. But most times, 98% of the times, after the embryo transfer, you are supposed to test positive in 2 weeks. That is 14 days after the embryo transfer. You get? Let me explain it again. When you go for IVF, after the fertilized egg, whether it's twin, triplets, or a single baby, embryo, has been transferred into your womb by the fertility doctor, you will be told to go and do tests in 2 weeks to check whether the IVF succeeded, whether the embryo implanted, and whether you have tested, you will test positive, because you are supposed to test positive for pregnancy. You are supposed to carry on with, you will get pregnant, then the baby will grow inside you. 2 weeks. If you test and it's positive, good. That's a successful IVF. If you test and it is negative, it does not mean it has failed already. Go and check again in a week's time to be sure. Most time when you check, it will be positive. If you check and it's still negative, it means that the IVF has failed. Go back to your doctor. Thank you and bye-bye.